India's coronavirus hotspot. Through drones, police scan the city. We can see if you come out of your homes, they announce. In the alleys of Mumbai's slums, health workers are trying to go to each one-room house, screening people for symptoms. This city has the highest number of COVID cases and deaths in India. But those on the front lines say the reality is far more grim than what statistics show. I spoke to a doctor at a Mumbai state-run hospital. He didn't want to be identified, fearing reprisal from the government.
Yes, we are under testing, under reporting. So the other day, 6 patients with acute respiratory distress syndrome, they were brought in dead. We didn't even test them, even though there was a very high suspicion that they might have had COVID. Now, even the relatives were not tested. One of the reasons why we're not testing deceased patients is there is a global shortage of the number of kits. So you want to use your kits very wisely.
It's not just here in Mumbai. Doctors in different parts of the country have told me that people with underlying conditions are often not enumerated as COVID deaths. The other problem is India's testing rate, among the lowest in the world, which means there's no clear picture yet of how bad it is here. A doctor from southern India described what she's been seeing. She too didn't want to be identified.
From my own eyes, they're not testing people. They're just not testing them. There's so many people who are coming with symptoms. They're going to go out and spread it to other people. We don't know how many people are affected by it. We are not ready for it, and there is no way we can contain it. And I'm really scared personally as a doctor.
India's health ministry didn't respond to the BBC's questions about official COVID numbers. The worst might still be some way off, but already nerves are frayed. Resources are falling short. We have to wait hours for patients to be admitted, these paramedics in Delhi told us. For weeks, India has been in lockdown, which is now set to go on until the 3rd of May. In many parts of the country, it's being strictly enforced. And is believed to have reduced the burden on hospitals to some extent. But experts say without ramping up testing, no nation can hope to beat the virus.
More sick people will keep coming and coming and coming until you have an extensive testing and isolation strategy. Or you can just stay on lockdown for long periods of time. But staying on lockdown for India has massive costs, especially for the poor.
Each day is hard for those left without jobs, money, food or shelter. Aid is reaching some of them, but there are questions about how long it can be sustained. Yogita Lamai, BBC News.